My name is Jessica Crunkleton. I'm a licensed marriage and family therapist, licensed mental health counselor, certified alcohol and drug abuse counselor, certified EMDR therapist, Sandtray therapist, and a whole bunch of other stuff. In honor of National Recovery Month, which starts tomorrow, September 1st, throughout the month of September, I'm going to be bringing to you just all different kinds of content related to addiction and recovery and those who support individuals in addiction and recovery. And it's going to be a lot of fun. So you should definitely like this video and subscribe to my channel and subscribe to the addiction and recovery series. So let's talk a little bit about National Recovery Month. So National Recovery Month was actually started in 1989. It's held every September, and the goal is to promote and support new evidence-based practices and treatments and recovery practices to support addiction recovery, also those in recovery communities and the service providers and communities that support those in recovery. And so this topic is near and dear to my heart as someone who is a certified alcohol and drug abuse counselor, who has worked with lots of families and individuals dealing with addiction and recovery who are dealing with substance use disorders and treating the family, helping them more understand better about addiction and recovery and substance use disorders and things of that nature. In addition, I'm also a child of an alcoholic. I'm an adult child of an alcoholic parent. And so I know what it was like having a parent who has substance use disorder and what that was like growing up with that and some of the challenges. So I'm going to be talking about all that. So we're going to get into it. I'm probably going to even invite a few of my friends in the addiction and recovery community along for this ride so that they can share their knowledge in this area as well, because again, we need community. This is done, recovery is, as you know, is done in community. And so addiction is in isolation. So we really want to promote that and just encourage recovery, celebrate those in recovery who are seeking treatment, trying to get help. We want to be here to support you all. In addition, two things that often get missed from the conversation about addiction and recovery, substance use disorders, is the trauma component. So the impact of trauma, how that impacts generational trauma, adverse childhood experiences. This is something that I specialize. I specialize in adverse childhood experiences. I am trained to teach organizations about adverse childhood experiences and to help them better understand how to integrate ACEs, the ACEs study, the ACEs questionnaire into their practices in whatever type of organization that they have. So it doesn't just have to be you work in the mental health field. ACEs, they cut across racial lines, gender lines, different types of organizations. So I think we all need to be more informed about ACEs and trauma and the impact, the connection between trauma, childhood trauma, these types of issues, and substance use disorders. There is a connection there that's often present that often gets neglected in these conversations. So as a trauma-informed therapist, I'm going to be sharing that with you because I think it's important for all of us to be educated on this topic. In addition, as a person of color, as a BIPOC therapist, as a Black therapist, African American, whatever you want to call it, I feel very strongly about the frustrations around the lack of culturally competent material related to addiction and recovery, substance use disorders. There just isn't a lot out of it. Often when I see materials related to addiction or recovery, substance use disorders, it's often kind of this general focus, and we don't really get into, again, racially, culturally, how the things that happen to us, the way that we grew up, our families, and the way that addiction may be seen in different communities. I know for me, as an African American, oftentimes when my family has talked about mental health, first of all, we didn't talk about it. If we did, it was more like you were either sane or rational, you were sane, or you was crazy. You was on like the sixth floor. There isn't really an in between, and there wasn't space to talk about addiction and viewing it as a brain disease, as something that's impacting the person, or, it wasn't really talked about. And also, sometimes when we talk about substance use and when we talk about selling drugs or different things like that, that wasn't seen as a problem, right? It was seen as, for some in my community, it's almost like such and such, they going into the street farm, they're street pharmacists, okay? And it's almost like this is a quick way to get money, instant gratification. It's hard out here. It's hard for me to go to college. I don't feel like I'm college material, but my homeboy wants to put me on so that I can sell, or whoever. And then once you go through that, oftentimes that leads to prison, okay? Now you have a record, now you're trying to get out. It's harder to get certain types of loans. It's harder to find a job. So it's like this cycle and it just kind of takes over, right? And so we're going to get into that, kind of dissecting some of that, talking more about that. So, but just looking at it from a racial, cultural component, that often gets missed, I think, when we have conversations about addiction and recovery, substance use, those kind of things. So, like I said, lots to come. I hope you tune in. It's going to be lit. I'll see you there.